Good afternoon, good morning to everyone from wherever you are tuning in. So my presentation is a bit different because the Academy of Science of South Africa, our project was different in the sense that we actually worked in collaboration with our partner academies in the Southern Africa Development Community region. Next slide, please. So we had a number of partners within the SADC region, the Botswana Academy, Mauritius, Kingdom of Eswatini, Zambia, Zimbabwe, the South African Young Academy of Sciences, Zimbabwe Young Academy of Science, Mauritius Young Academy, and the Democratic Republic of Congo Young Academy, which is also in the process of being initiated. Also, Mauritius is not in existence. So our project spanned around 6 months. And what we did that is different from the others was that at the beginning, each academy had an opportunity to hold its own dissemination event to its policymakers and stakeholders in their respective countries. So, for instance, Zambia held its own webinar on the 13th of October. The Kingdom of Eswatini Academy held its dissemination event on 26th of August, and SAIS, which is the South African Young Academy, held its dissemination event on 29th September. The Zimbabwe Academy held its own sometime in November. So everybody did their own thing. And then in the end, we brought together all academies and did a SADC-wide webinar. And in this webinar, which served as the dissemination event, we made it a SADC-focused engagement. So to open our webinar, we were delighted to involve the Secretariat of the Southern Africa Development Community, and the person who's in charge of the health portfolio was the speaker, who just gave an overview of the impact of COVID-19 on health systems in the SADC region. And other than this project, it would also be important for me to mention that as an academy, we have been involved a lot in since the pandemic started, because an academy is essentially made up of fellows and members. Members of ASAF have been very, very engaging and involved in assisting the national government to respond to the pandemic. Very well-known scientist, Professor Salim Abdul Karim, had been leading the Ministerial Advisory Committee on COVID-19 for 1 year. He stepped down, I think, at the end of April. The other one is a well-known vaccinologist, Shabir Madhi. He's been engaging the public, giving lots of interviews in trying to just demystify the science of COVID and how the government is responding, and the different concerns that people have about vaccines, for example. And another fellow is Professor Helen, and she has been leading something called the Sisonke trial, where they made available, she facilitated the availability of the J&J vaccine to health workers. And so you can see our fellows have been quite busy trying to get involved in the response. Also, we've held webinars. A recent one was understanding ivermectin for COVID-19 treatment. And we've released statements. I can name one: anticipated cost of COVID-19 to South Africa's quadruple disease burden. So we have been quite busy, and it has been quite an honor for the Academy to be visible out there to the members of the public in South Africa on what an Academy does. Next slide, please. So my next slides basically give a snapshot of what we were able to achieve in getting involved in this project. Next slide. All right, so the first outcome that was this project was basically an illustration of science diplomacy in action. What do I mean by this? By involving numerous countries who are our neighbors, we were able to strengthen relationships, not just with academies as the institutions, but also with countries. You know, science is a very it's an objective language. We can argue and disagree on many aspects, but if it is based on facts, people tend to get along much better. So the relations between the countries have been strengthened, and a very interesting thing was that the youngest academy in the Southern Africa Development Community, the youngest as of end of 2020, was the Kingdom of Eswatini. And this project was fantastic in the sense that by them collaborating with us, this project gave them the opportunity to host an event for the first time since they launched in November 2019. So, and it raised the profile of this academy within their own country, because they did launch and then they went quiet, they had no activity. But when this opportunity came, they were quite enthusiastic and they jumped on the train and we moved forward together. So we have been building the capacity, and for the existing ones, such as Zimbabwe, you know, the economic situation, the political situation, funding has been an issue for many years. So with by involving them in this project, we were able to stimulate them to host an activity. And in this case, even though it was just a webinar, at least they were able to reach the general public and policymakers, who were actually the most important stakeholder in this project. Next slide, please. So the next outcome we were able to achieve is to enhance the capacity in science advice of the different academies. So what I must mention that the Academy of Science of South Africa is one of the strongest within the continent and the strongest within the Southern Africa Development Community region. So what we always try to do in each project, as we partner, we try and build our neighboring academy so that we can all grow together and move forward together. So as a result of this project, the Zimbabwe Academy of Sciences was able to develop 3 policies, and these policies were the use of traditional medicine, which focused on the use of herbs, because many people have been watching on TV, reading. Most people who are opting for self-treatment are going to traditional healers and herbalists. And then this policy also looked at the consideration of the impact of indigenous knowledge systems and intellectual property policies. The next policy they developed was on social, economic, and political impact of COVID-19. So this interrogated the effectiveness of lockdown conditions because most of them were disregarded. It looked at strategies to sustain livelihoods under COVID-19 lockdown conditions, which is very relevant because when you lock down and your economy is not big and is not formalized, if most people are in the informal economy and you ask them to work from home, then you have to look at what does this mean for them? How will they earn their livelihoods by telling them to stay at home and without providing any funding relief? And the same policy looked at the assessment of the political aspects of COVID-19. We are all well aware that in many countries, the issue has been politicized, making it even more difficult for the respective governments to respond to it. And even now, we can see it very clearly, vaccines, people using politicizing the availability of vaccines and the people who can have access to vaccines. The last policy that they developed was an industrialization policy and geographical mapping. So this covered the mapping of COVID-19 confirmed cases, recoveries, and deaths, and the analysis of risk factors and mitigation strategies in high density versus low density geographical spaces. So this was actually an outcome of getting involved in our entire project. And as a result, for the first time, they are engaging directly with government officials in assisting the Zimbabwe to respond to the pandemic. Next slide, please. Also, as a result of participating in this project, my colleague, Dr. Stanley Maposari, and we co-authored an article in the American Association for the Advancement of Sciences publication. It's called Science and Diplomacy. Our article was called Connecting the Dots, the Role of African National Academies of Science in Informing the COVID-19 response. And you can find this article online, it's open access, and you will see that we actually talked about this project and how we were able to connect to our neighbors within the continent using this project. Next slide, please. This project also enabled all of us, our academy and our partners it facilitated the multidisciplinary interrogation of policy briefs, and which is quite important, especially to ASAF, and which released a statement on COVID-19 that called for the response to be multidisciplinary. If I may quote, the policy brief stated that we, meaning the academy, believe that the pandemic is not simply a medical problem, but a social problem as well. When it started, all we were hearing was from the health side, the epidemiologists, only the public health side. Only much later that people and scientists realized that there is a human face to this. So experts such as anthropologists, political scientists, economics need to be involved in the COVID-19 response. So in the practical sense, during the various webinars that ASAF and our webinars and our partners hosted, we encouraged them to constitute panels that are multidisciplinary. People do not just want to hear about the epidemiology of COVID-19. We would like to hear about this lockdown measures. How are they affecting our social lives? Because as human beings, we are social, and if we are only reduced to communicating virtually, what does that mean to our relations? And also the economics part of it. Most African countries, the economic impact of these lockdowns has been devastating. In South Africa, for example, the economic growth greatly slowed down, and it's only this year that the government has been trying to not have the severe lockdowns in order to give the economy a chance, because even the COVID-19 response, when you think about it, it is funded by money from tax. But if no money is coming in, then there is a problem. So the economists were very, very important in bringing in this aspect to the response. And then there are the political scientists who just tie all the responses together, and this has been quite important in showing that in the practical sense, every sort of aspect from every discipline has to be part of the response. Next, I think the last slide. So that is the end, and I want to convey our gratitude from the Academy of Science of South Africa to the funders, the Resolve to Save Lives, and PARC, and the facilitators, the U.S. National Academy of Sciences. Thank you.